I think the best way that we can influence policy is really from the ground up, especially in this COVID crisis. We've seen how badly the breakdown in communication has hurt us. It doesn't matter that we have the deepest well of scientific knowledge in the world in the United States if we're not effectively communicating it. And so I would say to young scientists to really understand that it's important it's important to run the marathon and to finish it and not to stop short of the end. And ensuring that the public understands not just the what we found, but what it means, how it affects them, and taking the time to correspond with them, I think is important.
Welcome to the official podcast of the Journal of Science Policy and Governance. In this podcast, students and early career researchers share more about their publication in the journal. Join us weekly to hear from the next generation of STEM leaders as we elevate their voices in science, technology, and innovation policy. So, welcome, and thank you for joining us for this episode of SciPol SoundBites, a podcast of the Journal of Science Policy and Governance. I'm Adriana Bankston, JSPG's Chief Outreach Officer and your host for this podcast. Today, we continue with episodes from the joint issue between JSPG and the National Science Policy Network, resulting from the 2020 Policy Memo Competition. Authors we are interviewing today are discussing important topics around healthcare on the national level. So let's talk a little bit about each publication. First, I'll introduce Rosalie Li-Rodenborn, who's a graduate scholar in public health biology at Johns Hopkins Bloomberg School of Public Health, and she's also a member of the Johns Hopkins Science Policy Group. She hopes to maximize the benefit derived from scientific research by translating it into effective policies. And her website, Novel Science, works to help scientists better engage lay audiences with content that is uniquely candid without sacrificing scientific rigor, and she hopes to pursue a PhD in service of these goals. The memo published in JSPG by Rosalie and her co-authors is entitled Improving Healthcare Access Among the Newly Decarcerated. Congratulations on your honorable mention. And we'd like to ask you to elaborate a little more about your publication. This seems to be a really critical issue for the United States, and especially in today's environment. Can you tell us a little more about your work and how you seek to address some of these issues?
So this brief for me was, I think, it revealed a lot about the way that we see this issue as a society and how I think we're cheating ourselves out of better outcomes because we're not approaching this scientifically. I think a lot of times when the issues are addiction or incarcerated populations, there can be judgment from cultural norms and things like that. But by looking at this, what we realized was that if we ensured that they didn't lose coverage in that small window of time from being released to when they found employment, they were much more likely to stay in treatment, to be successful, maintain employment. And this had tangible effects that are more obvious, like your cost in law enforcement and correctional facilities. But there were intangible costs to it too. And that was that kids were growing up in intact families instead of dealing with the death of a parent. And these are downstream effects, I think, that they would take a longer time to appreciate. And we get all of that from just filling this window. And so I think the investment, it doesn't just help the individual, it helps society as a whole.
Yeah, that's really helpful. I think you did a great job looking at the kind of broader implications of this, which is something that usually comes up later. So I'm curious also if you can talk about how you do this sort of research to find the information that you need for this work, just for our listeners that might want to be working on this topic.
Yeah, and this part is probably my favorite part of this brief. And this area is not the focus of my personal research. So being handed a brief, I think, gives you an experience that sometimes elected officials can have, where they're given a situation that they don't have expertise in dealing with it. But what we found was there may not be research that specifically addresses this, but there's a lot of research out there that is similar. And so we found what happens when you have coverage for people perhaps not newly decarcerated, or situations where employers had an incentive to pay for substance use disorder treatment. And by looking at these different situations, the impact on children, for instance, we were able to piece together a picture, and I think I'm biased, but a compelling argument that this is just an obvious, that funding this is the obvious right choice.
Great, thank you. So we'll come back to some of this later, but we'll move on to introducing Crystal Grant. So Crystal obtained her PhD from the Genetics and Molecular Biology program at Emory University, where she studied the link between human health and aging. She's also a 2020 Kristen Marzian Fellow at the National Academies, and through this position, she contributed to policies to increase the number of women of color in tech. Crystal is passionate about better understanding the effects of technology on society, and is especially interested in ensuring the benefits of tech are applied equitably and that tech costs developed are free of harmful biases. She is currently serving as a 10 Congress Fellow in the Senate, working on legislation and oversight around addressing disparities in health and tech. The memo published in JSPG by Crystal and her colleagues is entitled Reform Workplace Practices in Chain Pharmacies to Reduce Medication Errors. So I think this is a really important topic, especially given today's healthcare landscape. And Crystal, could you tell us a little more about your publication?
Yeah, absolutely. So yeah, I really enjoyed writing this. I wrote it with my colleagues Daniel and Jennifer from the Christine Marzian program. And it all started when we saw this piece in the New York Times about these retail chain pharmacies, and it was a lot of whistleblowers talking about, who are pharmacists, who were talking about how they were being really pushed to their limits every day, being asked to fill an impossible number of prescriptions on top of, like, calling patients, trying to get them to refill. And it sounded like a lot of them felt like they were at their breaking point. But because state pharmacy boards are the ones that control a lot of these practices by chain pharmacies, and because a lot of the chain pharmacy execs sit on these pharmacy boards, it's kind of like having like the fox guard the hen house, where there isn't this really needed regulation that there should be, because the people who are kind of like committing, who are making this workplace culture that is really difficult for pharmacists to keep up, are the same ones who dictate what the workplace culture should be. So that's why we kind of think there is a need for legislative intervention. And we were really, the memo really praises one state in particular, Illinois, which took the initiative to try to counter some of these unsafe workplace practices by these retail pharmacies. And we thought that that was a really great piece of legislation, and that if it were to be expanded nationwide by Congress, that it could do a lot of good in preventing medication errors and just burnout among a lot of pharmacy staff.
Yeah, that makes a lot of sense. So it seems like there is some state regulation here, but also could be a national, federal regulation. Curious what you think about other states adopting this, or how do you see this kind of expanding to a national regulation?
Yeah, and so that was something really interesting that that we dug into when writing the memo, because we really wanted to understand on a state-by-state basis where we are right now, and maybe even just like how bad is the problem of a lot of these execs from these companies sitting on the boards that should be regulating them, regulating themselves. And that was a really interesting deep dive to see kind of like which states, I think it was like specifically California and Illinois are the couple that have written legislation to try to address this issue, all the way through to states that I won't name names, but that have not, that have kind of gone the opposite direction. And we discovered, I think it was North Dakota is one of the states that exists in the US that actually doesn't have any of these large chain pharmacies at all in the state. So it definitely seems like it definitely seems like it's a widespread issue, and it could absolutely progress state by state, with each state trying to counter this, or it could kind of come from the top down, and the federal government could step in the same way that they do stepping in with regulating what can be in prescription drugs. We wonder if they should be regulating, you should probably regulating the environment that allows you to get your prescription drugs safely as well.
Yeah, that makes a lot of sense. And I think the other thing I was wondering about while you were speaking about this is how this affects different populations, because it seems like there are different levels of regulation here. So you have sort of the big cities and people who have more access to pharmacies, and then sort of the state and national regulation. So, and sort of, again, with your interest in diversity as well, can you comment on how this might this be dealt with in a way to also address some of these inequities?
Yeah, I guess I'm thinking that that this issue would help all Americans. Being able to, I think right now it's something like, it's like in the billions, the amount that this is costing, and it's between 7,000 and 9,000 Americans that are dying annually just because they maybe they went to get their medication filled, and maybe the pharmacist was just at the end of a long shift and was kind of stressed, and it's leading to these really terrible outcomes. So I think that it could help people from essentially every population, especially people who live in maybe more densely or populated urban areas where there really aren't these kind of smaller, like mom and pop, I should say, like pharmacies, and their only choice is these huge retail chains, where we can see that the practices are maybe not necessarily prioritizing patient health.
Yeah, that makes sense. So I want to kind of pivot to ask Rosalie kind of the same question, is because it seems like in your publication, so there's a lot of discussion around healthcare access. So I think there is, especially with COVID. I'm curious about what your take is on this. Are there ways to improve some of the policies that you're proposing to help specific populations that may not have access, or again, sort of the inequity angle for your topic?
I think COVID has raised a lot of topics related to incarceration, specifically these people who are not able to maintain distance between one another because of their living situations. I think, there have been different areas where they've decided, okay, nonviolent people or people who are due to be released very soon, that we will let them go. And I think that really we as a society need to examine the costs in keeping people in prison who perhaps really should be in treatment, and what we are really doing to ourselves there. And I think that the pandemic really raises those questions, because if we can let them go because their health is at risk, just thinking about the negative effects that happen in society, I just think that there's so much that with this crisis that revealing about the way that we approach the world. There's just there's a lot of room for growth. And of course, the outcomes, the disparities have been, horrifying. But I do find hope in that we can draft effective policies, and we can change these things if we choose to.
Yeah, I'm glad you brought up that point. So this is something that has come up in other conversations too, for different ways to address some of these things, whether it's legislative, whether it's state level or national, so on. And I think a lot of young scientists who are looking to work on these issues are thinking about how would you actually develop or suggest a policy that might actually be able to address this. So do you have comments on what does it mean to basically craft an effective policy or good policy making? What does that mean to you?
I think the critical, the principle that I think a lot of people, and I myself, missed until I started studying science policy, is that when we approach policy an issue, our job is not to decide whether or not the people who we're discussing are worthy of our time or help. And I think that a lot of times we can get bogged down in that, kind of making a moral judgment where, as somebody drafting a policy, your job is to look at the situation and see how you can make it better. That's your job. A good example of this that I've discussed with people at length are clean needles exchange programs. And I've had, candid conversations with friends who don't understand why we should be investing money getting clean needles to people who are, using IV drugs. And I really posed the downstream effect to them. They go home to partners who they may infect. And in fact, there was a huge HIV epidemic in Indiana when the current vice president, he was in charge of overseeing it, I believe. And there was just, I feel like they delayed action there because they got bogged down on whether or not we should be helping these people. And the question, I think, that's not something that we as policymakers should be asking. We should just be asking, how can we make this situation better? And so I think doing that is how you make effective policy. Being willing to set aside, how do I feel about this situation? And looking at it like that. But I also think that setting aside how I feel about it has shown me that we do not have enough compassion for these populations. And I don't know if cruelty is the right word, but our indifference to them is actually hurting us too. And I think that's really kind of a profound thing that I realized while doing this.
Yeah, thank you for that insight. That's really interesting to hear and makes a good point by giving the example that you had. So I want to ask Crystal this question too. So, because you sort of brought this up in terms of, okay, what does good policy making mean, but also in the face of somebody that might oppose what you're trying to do? How would you address that?
Yeah, I think that if people don't agree with policies for their own, own like maybe moral reasons or ideological reasons, that you can try to appeal to just the financial cost of not implementing the policy change. So yeah, in us kind of researching to write this memo, we realized that just the effects of mitigation errors on the U.S. is 40 billion each year. And I think that, even if you believe in smaller government or tend towards inaction, or fear or regulation, I think that learning that any change could save $40 billion a year, I think that that's a good way to appeal to people who maybe don't agree with your ideology, is after you've made your case in terms of morality and like, we have to help these populations, and if that still hasn't swayed them, it's like, okay, well, here's how it will affect the bottom line. And it's just another kind of tool in your toolbox in writing good policy to make sure that, or to try to find policies that both make sense in terms of your ideological beliefs and your moral beliefs, but that can also make economic sense by fixing an expensive problem, which our healthcare system is very expensive. So any problem that can be solved there, I would hope that anyone would get on board with.
I think Crystal's point there is really good, and I think so important that we can't assume that people will feel a certain way about an issue. And so thinking about the fiscal side of it, I think it is important that you need to make arguments for multiple perspectives. And like for our my particular policy, we found that for every dollar invested in substance use disorder treatment, we saw $11 returned. So that return on investment is astounding. And I think you would be hard pressed to find somebody who, even if they don't necessarily feel they want to help this population, would see the state's bottom line and maybe then be willing. And you have to understand that you may have to appeal that way.
Yeah, that's a really good point. Thank you. And to take that a little further, I was thinking about this, but something that you mentioned earlier is that we're not really using always scientific approaches or the best approaches to address some of these things. So thinking about, graduate students and young scientists who are listening to this, how can we train them to, use their expertise to influence policymaking? What would you advise? Maybe Rosalie, if you want to start.
I think the best way that we can influence policy is really from the ground up. Especially in this COVID crisis, we've seen how badly the breakdown in communication has hurt us. It doesn't matter that we have the deepest well of scientific knowledge in the world in the United States if we're not effectively communicating it. And so I would say to young scientists to really understand that it's important to run the marathon and to finish it and not to stop short of the end. And ensuring that the public understands not just the what we found, but what it means, how it affects them, and taking the time to correspond with them, I think is important. The other thing I would add is, there's so many wonderful institutions in the world, and they have, they draft policy, and it's wonderful. We need that. But there is a bit of a gap in scientists that people feel like they know, that they feel like they know them in the way they might a beloved elected official. And not having that human connection, I think, hurts our communication, because we're not relating to them. And who are these very standoffish scientists that we don't really know a whole lot about? I think that if we relate more candidly, that will be more effective.
Great. Yeah, that makes sense. Crystal, do you have anything to add?
Yeah, I think that those were all great points. And I think that there are a ton of ways to get involved. If you realize that this is a career path that you're interested in, I think it's just important to just get started. Like, start trying to identify policy issues, start thinking of approaches that would help fix them, reach out to your local reps and local senators, and just try to like get as involved as possible, and get involved, of course, if your like institution has a group of people interested in science policy. If it doesn't, to start one. And I really just want to echo that point of like, scientists are not, I feel like we're really well respected in to the American public, but definitely not like be well understood necessarily. And it's been really surprising to me the number of people in my PhD who, you know, when they were told you need to make this more accessible, kind of pushed back and said, well, why should I have to water it down? And it's just, I think that an individual like trainee who's thinking, what can I do? I think the number one thing is just like improve your own communication and get out into your community and volunteer and just get people excited about science. And like, you don't have to use the exact terminology that you would with your PI. You can just like learn how to say it the way you would to a child or to a or like to your grandma is like the great example. I think if everyone who is thinking about SciPol as a career just focused on how can I improve my individual communication, and even just encourage friends to do the same, that it would really kind of help improve the standing of scientists, instead of just being kind of respected and not understood, to being well respected and well understood. So yeah, I think just improving individual communication and trying to volunteer in the community and just make science not scary, because there's so many people who are so afraid of it that the minute they hear what you do, they kind of tune out. And I think if we can counter that among more people, that's the biggest thing we can do to get more people on board with trying to understand science and seeing how much it is needed in policy.
Yeah, those are great points. So I think it's a good segue to this question. I think we may have to wrap up after this. So in relation to the experience of publishing in JSPG, I think a lot of this, it's really helpful to a lot of students who want to go into policy careers, and a lot of them, this is the first time they've done something like this. Can you comment about your experience in publishing here, and if you have any advice for students who are looking to publish, and how they can be competitive or prepare for it?
I think the most important thing about, especially when you're team writing like this, is acknowledging that you bring something to the table that has value, and so do the other people. And understanding where you have weakness it's important, because you can work so much more effectively when you don't believe that you can do it all on your own. And so really acknowledging that together that you are a stronger writing team, I think that's one of the big things people could do.
Yeah, I would say that I really loved this process of getting to write this memo. I think it's so completely different from writing a scientific paper, where the whole focus of writing work like this is like, can you convey your point as clearly as possible, as effectively as possible, in as little as succinctly as possible. And I feel like succinctness is not something that like academia is known for. So that was a huge kind of shift in gears to learn. I wrote so many pages of background that we ended up scrapping because it was like, okay, they don't need to know all of that. So I thought this was a really great experience, and I really hope that other like trainees who are interested in SciPol also will write a memo. Just because I think that I'm working in the Senate now, and I'm writing memos all the time, and I'm writing bills, and I am seeing that my writing needs a lot of work, because I'm very used to that kind of academic writing of like, we have like, Z was observed and we think it might have been caused by Y, X could be a contributing factor. Whereas this kind of writing in the like the policy space is just like, Z was caused by Y, like that. It's just that simple. You can just say that. It doesn't have to be, sort of wrapped in all of that extra language. So that's kind of something I wish I had done differently in my PhD, was to get more experience writing memos and writing about policy, and just learning how to write in this way that is much more direct and more succinct. So I thought this was a really great experience, and I wish I had done this kind of work sooner in my academic career.
Great. Yeah, that's good advice. Thank you. So we're nearing the end. So I want to thank Rosalie, and Crystal for joining us today. You can find this episode and others like it on JSPG's YouTube channel and on SoundCloud. And that's it for this week on SciPol SoundBites, the podcast of the Journal of Science, Policy, and Governance. If you enjoyed this episode, subscribe to our podcast on YouTube and SoundCloud. You can also follow us on Twitter, Facebook, and Instagram at SciPol Journal.